Yeah, I guess if your penis falls off, then it can't have an erection very
That's
easily.
pretty dysfunctional.
If you're a rat.
I guess on to number 2 for potential side effects of finasteride and dutasteride, erectile dysfunction.
Yeah, I guess if your penis falls off, then it can't have an erection very easily.
That's pretty dysfunctional.
If you're a rat. Yeah, but in all seriousness, this is certainly a plausible side effect, especially if you have a high amount of inhibition in the 5-alpha reductase isoenzymes that are concentrated in pubic skin, which is penile skin, scrotal skin. You could see a loss of sensitivity. Perhaps this is a more significant effect in individuals that are less sensitive to androgens, that have a lot of CAG repeats. See our podcast on that. Perhaps it would also apply more in the case if you did not have foreskin, if you were circumcised. Again, less receptors. Just like there is a huge debate on whether or not it is inhumane to circumcise a child, which maybe we'll talk about that in the future. And my various experiences, people know I delivered several hundred babies and I have a couple male children myself, but we'll leave that for another day. That's how I think of the potential reasonable side effect of ED.
Yeah, in talking about the differences in dutasteride and finasteride, the tribe in one of those countries in South America, we were looking into this a bit earlier. I know that Derek with More Plates, More Dates and Andrew Huberman had a great conversation about this. And those individuals will lack the type 2 5-alpha reductase enzyme while still having type 1 and type 3 intact. So they should have some level of DHT, but the type 2, which is heavily concentrated in prostate and genital skin, leads to a incomplete or very limited development of the external genitals until their testosterone levels rise considerably. Yep. So
they're pseudohermaphrodites.
Being a very potent inhibitor of that type 2 leads me to think that would be a more significant concern there compared to dutasteride. And we don't have the same exact cohorts, but when we look at the side effects between, let's say, 5 milligrams finasteride versus half a milligram of dutasteride, it seems like the dutasteride is better tolerated, at least from a sexual standpoint.
Yeah, I think it's a good summary of ED. The next one kind of goes hand in hand with it. It is decreased libido.
Yeah, and again, same thing. If you are someone who has low net androgens, it's very plausible that pulling down that DHT, it's kind of doing the heavy lifting if you have a low testosterone, can kind of unmask this low net androgens in your libido. And the same thing with the CAG repeats. This is something not a lot of people talk about, but something that our clinic will test for in the right patient. So if you have someone who's very concerned and they want to have all the data up front before they start on something like finasteride, probably the higher that number, the less sensitive the receptor and the more likely that person is to be sort of dependent on that DHT to get androgenic signaling. Although not always. If you have a very high testosterone, low DHT, and even if above average CAG repeats, that's not a guarantee that you're going to get side effects. It's just something to consider in your discussion with the patient.
Yeah, the next potential side effect is impaired spermatogenesis. This is usually discussed in the concept of what's called intratesticular testosterone and the positive feedback that intratesticular testosterone has on Sertoli cells and the seminiferous tubules and basically the area where the sperm is formed. However, what this really is impaired intratesticular androgenic signaling. Because of course, if anything, finasteride or dutasteride increase testosterone itself. Yes, DHT can be synthesized without testosterone as an intermediary, contrary to what we previously believed. But in general, dutasteride, one of the main downsides of that compared to finasteride, other than its slightly longer dose-dependent half-life, which we talked about extensively in the past, is
including a post about a year ago on your Instagram.
Yeah. So we've talked about that quite a bit, and maybe we'll get a little bit into it as well with rehashing some of the pharmacokinetic curves. But basically, if you plan to conceive within 6 months, pretty reasonable to not take either finasteride or dutasteride because of impaired spermatogenesis and theoretical epigenetic or genomic changes, especially dutasteride.
Yeah, and this goes for a number of different medications. Anything that's potentially anti-androgenic I would personally stay away from, and we counsel our patients prior to conception to avoid these things for at least 6 months. There's a paper that came out probably about a year ago with metformin and the fathers taking this, and seeing some higher rates of birth defects in the children.
Yep.
Now, do we know if, I think actually both groups were diabetic in that case. But again, small study, but to err on the side of caution, like obviously you don't want to have uncontrolled diabetes when you're trying to conceive. That's going to also have some unfavorable epigenetic changes, but definitely talk with your doctor or nurse practitioner and see, which medications would be reasonable to discontinue in order to have the largest number of sperm, the healthiest sperm, so that the best sperm wins the race to the egg.